All right, so with that, what I want to do is I just want to open it up, and you guys can ask me questions about anything. And just ignore all these cameras for your pretend they're not there. The only thing I would ask is introduce yourselves so that I get a chance to know you. Or if you haven't met one of your neighbors, there's a good chance for you to do so. But why don't we start with this gentleman right here? And we've got some mics. The main reason we're using mics is so that these folks behind us can hear you. This gentleman right here. Oh, you're doing great.
My question is actually about healthcare. My brother is disabled. He is definitely what I would consider working for. He will not mature anymore as far as mindset of a 12-year-old. Right now, he works, washing dishes at a local restaurant, and unfortunately, because the employer does not offer healthcare insurance, one whole check, which is 2 weeks worth of work, has to actually go towards, him just paying for COBRA, which is obviously well out of his budget, but he has to simply because of various illnesses that he suffers from. My question is, unfortunately, I'm not able to sit down and read a 2,000-page bill or law with all the reform that happened with healthcare. With the present reforms that went into place, how will that help him? And if it doesn't, then how will, I know that you're not done with healthcare, how will the latest changes that you want to happen with healthcare, how will that help him? And thank you for doing such a wonderful job.
Well, thank you. Here's how specifically health reform should help your brother. Number one, it gives an incentive to his employer to provide health insurance. Because one of the key components of healthcare reform was providing employers a 35% tax break on the premiums they pay for their employees. Right? So basically, it's cutting his potential costs, the employer's potential costs for providing your brother with health insurance, it's cutting it by a third. That's step number one. And there are going to be companies out there that say, you know what, we want to provide health insurance, but we just couldn't afford to do it. But now that it's costing us up to a third less, saving us thousands of dollars, maybe we should go ahead and provide coverage for that. Okay, so that is step number one. Step number two is if the employer still doesn't provide coverage, over the next couple of years, your brother is going to be able to join a pool, what we're calling an exchange, where he can basically buy the same kind of insurance that these members of Congress are buying. And the advantage that he's going to have is that now he's part of a pool of millions of people who are buying it all at the same time, which means they've got leverage the same way big companies are able to lower their costs per employee because the insurance company really wants their business. Well, now your brother could be part of the same pool that these guys are, and that's going to give leverage, which will lower his rates. And the final part of it is, if even with these lower rates, this better deal, he still can't afford it, then we're going to provide some subsidies to help him. So all those things combined should help make sure that your brother is getting health insurance. Now, one of the things that I think people may not be aware of is that although this exchange isn't going to be set up until 2014 because it takes a while, we've got to set it up right. There's some immediate things that are helping right now. If your child has a pre-existing condition, insurance companies starting this year will not be able to deny those children coverage. And that's a big deal for a lot of folks whose children may have diabetes or some other illness and right now can't get insurance. Insurance companies are going to have to provide them insurance. That's number one. Number two, how many people here have kids who are college age, about to go to college? All right. Well, one of the things you're going to be able to do is when those kids get out of college, if they don't get insurance right away, they're going to be able to stay on your insurance until they're 26 years old. That's a big deal because a a lot of times that first job or those first couple of jobs out of college are the ones that don't provide health insurance. So there are a number of changes that are being made right now that will make those of you who have health insurance more secure with the insurance they have. We're eliminating lifetime limits. There's a bunch of fine print on the insurance forms that sometimes have ended up creating real problems for people. Your insurance company decides to drop you right when you get sick, just when you need it most. Those kinds of practices are over now. And the final aspect of health reform that's important is that by changing the incentives for how doctors get paid under Medicare and under Medicaid, we're actually encouraging doctors to become more efficient so that over time, healthcare costs actually start leveling out a little bit instead of skyrocketing each and every year. Because everybody here who's got health insurance, what's been happening? Your premiums have been going up, co-payments, deductibles, all that stuff's been going up. So we've got to actually try to control the costs of it, and part of it is just a matter of making sure that we get a better bang for our healthcare dollar. So for example, when you go to a doctor, we're still filling out forms in triplicate on paper. It's the only business there is where you still have a whole bunch of paperwork. And what we're trying to do is to encourage information technologies so that when you go into a doctor, they can already pull down your medical records electronically. If you take a test, then it's sent to all the people, all the specialists who are involved, so you don't end up having to take 4 or 5 tests and pay for 4 or 5 tests when all you needed was just one. Those are the kinds of things that will take a little bit longer to actually take into effect, but hopefully over time, we're actually going to lower costs. All right. I'm going to go boy-girl here to make sure it's fair. Right here. Absolutely.
I'm concerned about the furor lately. It's been similar to what's happened in the past, but it's re-emerging, mostly from the Republican Party, but some Democrats, that Social Security needs to be privatized because it's losing money and we're all it's going to go broke and that sort of thing. How would you comment on that?
I have been adamant in saying that Social Security should not be privatized, and it will not be privatized as long as I'm president. And here's the reason. I was opposed to it before the financial crisis. And what I said was that the purpose of Social Security is to have that floor, that solid, rock solid security, so that no matter what else happens, you've always got some income to support you in your retirement. And I've got no problem with people investing in their 401ks. We want to encourage people to invest in private savings accounts. But Social Security has to be separate from that. Now imagine if Social Security, a proportion of that, had been in the stock market back in 2006 and 2007. I mean, you saw what happened with your 401ks. You lost 20, 30, 40% of it. Now we've recovered, in part because of the policies that we've put in place to stabilize the situation. The stock market has recovered 60, 70% of its value from its peak. But if you were really in need last year or the year before, and suddenly you see your assets drop by 40%, and that's all you're relying on, it would have been a disaster.